Hey everybody, welcome back to the show. Listen, today I'm out here at the Greenfields Continuing Care Community where a lecture is coming up inviting you to learn more about how behavioral medicine can help treat chronic pain. Their guest speaker for this is Dr. Christopher Radzowan with more.
Well, behavioral medicine is the study of looking at how people's mood, how their thoughts, their cognitions, how their behaviors all interact with their physical health to kind of create an overall health for them.
Doctor, how and why does learning behavioral medicine techniques help a patient who may be using medications for their chronic pain?
Well, I think so often people struggle with skills. You know, they may have had kind of heavy skills before they were injured or before their illness developed, but then they seem to kind of struggle a bit with that. Mm-hmm. So learning different skills allows them, especially skills focused on how they process information, how they interact with others, skills to help their mood, skills to manage their behaviors, really allow them to manage their illness more effectively. This allows them generally to cut back on pain medication, be more active.
And doctor, tell us about some of these coping skills that you can help them with.
Well, a lot of times we focus in helping them learn skills in three basic areas. In one way, we'll focus on kind of their thoughts, how they think about people, how they process information, or how they think in general, how they process information. Sometimes looking at worry, stressful cognitions, the pressures they put on themselves, how they judge themselves. Mm-hmm. We also kind of look at physical tension, and we know that pain can often be exacerbated by muscle tension, kind of physical stress. We work on some strategies to help them manage that more effectively. Mm-hmm. And then also we look at behaviors in general. So often just thinking about chronic pain, what we often notice is that clients kind of have a boom or bust pattern. So on a day they feel pretty good, they do a lot. Well, unfortunately that sometimes leads to a few days where they're in more pain, they're struggling, and it's just an ineffective way to manage. So if we can work with them on better ways to pace, better ways to kind of be aware of that, they can in the end often be more productive without that boom or bust pattern of pain.
What if somebody has been on these medications for a long time?
No, I think it still fits. Mm-hmm. I think sometimes a big piece of it is helping patients buy into that, getting them to kind of see some small successes through treatment where they kind of see that, all right, this is working, so maybe I can try to cut back a little bit.
Here at the Greenfields Continuing Care Community, lectures like this are planned often for your good health. And like the others, this one will also be taking place here in the Richard C. Siebold Auditorium.
For people who might not be familiar with the Greenfields, we are one of the most comprehensive rehabilitation providers in all of Western New York. In fact, we provide physical, occupational, and speech therapy services in both in and outpatient setting. And we cater to a variety of diagnoses, which might be orthopedic, cardiac conditions, neurological impairment, even post-stroke. And regardless of their diagnoses, injury, illness, accident, they're suffering and pain. And we find folks are often managing chronic pain. And while rehabilitation is a fantastic way to manage that pain, we recognize that people are looking for alternate forms of treatment, which has led us to partner with UBMD Physicians Group on this presentation. It's a safe space where people can come together, get one-on-one time with the physician. It's free, it's open to the public. We always provide complimentary refreshments. We simply ask that people register for the event.
The Greenfields host Beyond Prescriptions, Treating Chronic Pain with Behavioral Medicine, Friday, November 15th at 1:30 p.m. Call 684-8400 to register or log on to thegreenfields.org.